Hey there, I'm actually doing a YouTube video. How novel of me, I know. Why? Because I want to talk long form about what's going on with the mental health crisis here in Oregon, what's going on with my family, outdoors, and I really can't seem to find a better place to do it than here on YouTube. Seems to be the best platform for this kind of thing. If I can get my camera to stay straight and the light to stay on, we'll see. And I want to talk about the fact that it's okay to not be okay. I'm not okay today. I am very frustrated. If you've watched me on Instagram, on YouTube, you know that me and my wife adopted 3 kids from foster care. Our 2 oldest have special needs, and they were abused and neglected in every way possible before we adopted them. And for the last 11 and a half years, we have tried desperately to get them the help they need, the proper diagnoses, to no avail. Recently, we've begun to see some traction. Recently, we've begun to see some things happen, but it's extremely daunting. And today's Sunday when I'm filming this, and I know that tomorrow morning I'm going to wake up, I'm going to eat breakfast, get everything ready, write some emails, take my daughter to school, go by the river, film some things, and then when 9 o'clock rolls around, I'm going to have a bunch of emails. Right now we have like 7 different organizations and agencies involved in my children's cases, trying to get them the help they need. And it's just utterly exhausting. And what's frustrating is Oregon has a mental health crisis, especially for children and teens. Oregon ranks 51st in the nation when it comes to mental health services for children and teens. And there are so many other parents who can't even get this level of attention. And there's 2 reasons why we're able to get this level of attention. The first is my wife, who has a bachelor's and master's degree in education, who's one of the smartest people you'll ever know, was a business owner, an educator. She quit her career to manage our 2 oldest care full time. The paperwork, the meetings, the phone calls, the logistics of it all. That's what she does full time now. She doesn't work. Not a lot of families have that luxury. To survive, you have to have 2 incomes in this country right now. If you have a family, unless you have a really good job, which I'm an influencer, I am able to provide. I'm very lucky that I get to do what I do. And that's the other flip side of this. Another reason why we are able to get the attention for this that we need is because I've been able to bang a drum on my Instagram, on my TikTok, saying, hey, this is an issue. We need to do something. And it's begun to get the attention of the right people, lawmakers, people in state agencies. And then I hear from other parents in Oregon who are going through very similar things, who both parents have to work because they have to. They have to make ends meet. It's hard to buy groceries right now. Try buying eggs right now. Like if you can find them, there are $8 for a dozen eggs. Like, dang, that's a lot of money. They just can't do that. And the other side is they don't have the influence that I have. Like I like to tell people, in this country, to get anything done, you have to have power, influence, and money. I don't have a lot of power. I don't have much money, but I have a lot of influence. And that's why I've been able to get the attention. And so I'm able to tell, other adoptive and foster parents in Oregon or parents who are trying to get mental health services for their kids. Okay, I did this. I talked to this person, that person, to see what that does, which is great. But at the same time, those things should just be available because mental health care is healthcare and healthcare is a right. And those are things that we need in this country. And yet we still are failing our kids and we're failing them tragically. And I'm constantly calling on Oregon Governor Tina Kotek to declare a mental health care state of emergency, especially for children and teens in Oregon, because we do rank last. It's sad and we need to fix it. And today I'm not feeling okay about it all. I'm not feeling good. I'm feeling down. Like I know on the internet, people see me as this happy, chipper guy who's, dancing around saying, you're awesome. And you are. And all those things I say and do, I believe. And I'm normally very much, yeah, kind of guy. I like to look on the bright side. I like to give people the benefit of the doubt. But I have become jaded over time. And I'm just exhausted and tired. And I want things to change. I want there to be change. And that's why I'm hiking the Oregon section of the Pacific Crest Trail. That's why I'm bringing attention to this issue. That's why we're working on getting a documentary crew to follow me and getting right now some production studio to back that. And if we have to self-fund, we'll self-fund. We have the ability to do that. That's why I call on the attention of local media and now state media is getting involved, and I talk to legislators because mental health care has been being so downplayed. Like I was in a conversation with someone a few weeks back last year who, you can see the conversation on YouTube, who talked about how mental health is a joke and people in other countries don't have mental health issues and we're just weak in this country, which I completely disagree with. And that's attitude that's definitely coming about. That's an attitude that has happened today. Hold on one second. I'm having a rough day today. I'm finishing. I was posting something on TikTok. I need to finish doing that. 1 second here. And we're going to post. All right. Anyways, what was I saying? Yeah, like, I don't understand why years and years go by and we don't take mental health seriously. We don't fund it the way it needs to be funded. And this is not just, an issue of needing mental health care and practitioners and therapists. It's an issue of preventative, like what our society has done as a whole with our education and social services and providing support and providing community. It's really sad, and we need to kind of rethink how we're going to move forward as a society, how we're going to, I don't know. The mental health crisis is obviously getting worse, especially here in Oregon. We rank 51st in the nation. I think we're 51st in the nation for children and teens. I think we're 49th overall. I think we're like 47th for veterans. Like, it's horrible. And I'm working with organizations like You Are Not Alone and Jewel, working with the Mental Health Coalition, just to break the stigma of that. We'll let people know, it's okay to not be okay. And that's ultimately what I want to convey is it's okay to not be okay. It's okay to need help. And there should be ways to get that help. We shouldn't have to beg on the internet or quit our jobs to get help for ourselves or for our kids or for our family. But that's unfortunately where we're at right now. And it's incredibly frustrating. So I guess I just leave you all with a question is when you're feeling down and, overwhelmed, like I'm just feeling very overwhelmed right now with the world and the position we're in, trying to fight for my kids, and how we're giving everything. And it feels like, I know objectively we are getting somewhere finally, but it feels like you're getting nowhere. And it's been a long fight. Like, we've been fighting this particular fight for like 6-7 years. And I finally, this last year, decided to start using my platform to really bring attention to this. And it's finally reaping some results. But it shouldn't be this way. It shouldn't. Especially for those most vulnerable, adopted through foster care system, who are like my children, who are abused and neglected in every way possible. Like, it's just not right. So anyways, I think I'm just going to do more of these because I like the background. It's cool. If you don't follow me on the other apps, at Annie Films and Hikes. And yeah, take care of yourself. And remember, it's okay to not be